In the last number of years, there has been a much greater public awareness and discussion about issues related to mental health and mental health conditions. And this has been great as it's shone a spotlight on issues of mental health and mental wellness, and people today know more about mental health conditions than ever before. But the downside of this is that there's a lot more myths and misunderstandings about mental health. And today, I want to talk about some of these myths that cause a lot of misunderstanding about obsessive-compulsive disorder, or OCD. Now, OCD is often misrepresented in the media and in everyday conversations, leading to a lot of misconceptions about the condition. And the challenge with these misunderstandings is that they could prevent people from seeking the help they need or from supporting loved ones who struggle with OCD. So, in today's video, we're going to talk about 5 common myths about OCD, some of which may surprise you. Now, myth number 1 is that OCD is just about being clean and organized. One of the biggest myths and misunderstandings about OCD is that it's just about being a neat freak, like the character Monica from Friends. This myth implies that OCD is merely a preference for cleanliness and order. Now, while some people with OCD do have obsessions related to cleanliness or organization, OCD can manifest in many other different ways. For example, some people with OCD have intrusive thoughts or images about harm coming to themselves or loved ones. These thoughts can be incredibly distressing and can lead to compulsions like checking locks multiple times to ensure safety, or repeating specific actions to prevent a disaster from occurring. Other people with OCD may have compulsions related to counting or symmetry, or even needing to perform rituals until things feel just right. These obsessions and associated compulsions in OCD are rooted in anxiety, and they cause a person tremendous distress. These obsessions are something we call ego-dystonic thoughts. Essentially, these are thoughts that go against how we view ourselves. So, for example, a caring and loving mother may have obsessions about killing her child in their sleep, which causes huge amounts of anxiety because the mother is mortified that she would even have a thought like this. The thought goes so against how that mother views herself. That's what it means that these thoughts are ego-dystonic. Now, for Monica and Friends, the preference for cleanliness and order was not ego-dystonic. It didn't bother her, but rather she took great pride and great joy in making sure that everything was clean and orderly. So it's important to understand that OCD is associated with anxiety and emotional distress rather than a preference for cleanliness and organization. Myth number 2, people with OCD can just stop their behaviors if they try hard enough. The idea behind this myth is that people with OCD can simply stop their compulsive behaviors if they really want to. This myth undermines and invalidates the reality of what it's like to live with OCD. So it's important to understand what OCD actually is. OCD is characterized by these unwanted, intrusive obsessions, those ego-dystonic thoughts, and repetitive behaviors or compulsions that a person does to reduce or eliminate the distress that's caused by the obsessive thoughts. Imagine being told that you had to stop blinking or had to hold your breath indefinitely. You may be able to do it for a little while, but eventually the discomfort becomes unbearable and that you have to blink or have to take a breath. For someone with OCD, resisting compulsions feels just as difficult. The compulsions are responses to overwhelming anxiety, and resisting them can feel impossible and can cause significant distress. So it's not something that a person can just stop doing if they try hard enough. Now, it's important to note that one of the best treatments for OCD is something called exposure and response prevention, which involves a person with OCD resisting the compulsive behavior. But this is done in a gradual way, rather than just telling a person to stop it. Myth 3, OCD is just a personality quirk. Now, many people think of OCD as a personality trait rather than an anxiety-based mental health condition. I'm sure at some point you've heard someone say, "I'm so OCD about my desk," when what they mean is that they like to keep their desk neat and tidy. Seeing OCD as a personality quirk trivializes the disorder and overlooks its severity. And it also invalidates the distress and the torturous anxiety that people with OCD often experience. So what you might see on the surface is someone who's bright and energetic, who seems to have their life all together, but beneath the surface, for someone struggling with OCD, their day is consumed by obsessive thoughts, constantly thinking about contamination and cleanliness. The person may sneak away to wash their hands in a ritualized way, spending hours, sometimes to the point where the person's skin is raw and bleeding because they're washing so often. This isn't a personality quirk. It's an awful disorder that can impact a person in all areas of their life. People with OCD often experience significant distress and impairments in their personal and professional lives. The constant obsessions and compulsions in OCD consume many hours of a person's day, severely affecting their ability to work, to study, to maintain relationships, or even take care of themselves. And the intense anxiety and frustration associated with OCD can lead to depression and other mental health problems. Myth number 4, only adults can have OCD. This myth is a surprising one for me, but I've heard from a number of people that they believe that OCD is only a problem in adults, and this couldn't be further from the truth. OCD can affect people of all ages, including children and teenagers. In fact, research shows that many adults with OCD began experiencing symptoms of OCD in childhood or adolescence. And in that sense, OCD can become a lifelong condition for people. So early signs of OCD in children might include things like excessive washing, checking, or repeating questions as a way of seeking reassurance. They may also display behaviors like arranging objects in a specific order or needing to do certain behaviors a set number of times. Now, it's important to note that depending on the age of the child, a lot of these types of behaviors are completely developmentally appropriate and normal. However, once it starts getting to a point where these behaviors start interfering in the child's life, or start causing them distress, or start involving the family in ways that can become increasingly disruptive, then that's a sign that these behaviors are problematic. These types of OCD behaviors are not simply phases that children will outgrow. They're usually early warning signs of a potential problem that needs to be addressed. Early diagnosis and treatment for OCD can be really effective and can prevent more significant problems if the OCD goes unchecked throughout adolescence and into adulthood. And finally, myth 5, OCD is caused by bad parenting or a weak personality. This myth is not only untrue, but it's also incredibly harmful because it can lead to a lot of unnecessary guilt and stigma for a person with OCD. This myth suggests that OCD is a result of someone's upbringing or some sort of character flaw because of a lack of willpower, and neither of these is true. Now, while we don't know the exact cause of OCD, what we do know is that it's likely due to a combination of multiple factors, including genetic, neurological, behavioral, cognitive, and environmental factors. Research has shown that OCD tends to run in families, suggesting both a genetic and early childhood learning component. Neuroimaging studies have also identified differences in brain structure and function in people with OCD, suggesting some possible neurobiological causes. The idea that OCD is caused by bad parenting or lack of personal strength ignores the complex biological, social, and psychological components that play a role in the development and maintenance of OCD. By understanding some of the complexities around OCD, this can help reduce some of the stigma and encourage people to seek the help they need without concerns that they or their parents are going to be blamed for their OCD. So there you go. We've myth-busted 5 common myths about OCD. So it's important to remember, OCD is a real mental health condition for which we do have effective treatments. And if you want to learn more about effective treatments for OCD, most notably exposure and response prevention, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.